Hi, my name is Jromska. I'm going to perform my abdominal and musculoskeletal video. I'm going to go ahead and show you around the room. That way you can see that there's nothing there. That is my patient. I'm very good at this. Okay. All right. So we're going to go ahead and start the video. Prior to beginning the video, I checked the patient's chart, reviewed the doctor's orders, and now I'm going to go ahead and greet my patient. Hi Sierra, my name is Jessica. I'm going to be your student nurse today. We're going to perform an abdominal assessment and a musculoskeletal assessment, okay?
Okay.
All right. I'm going to go ahead and provide for privacy, wash my hands. Can you give me, or tell me your name and date of birth, please?
Jromska, 9/23/01.
All right, very good. Thank you. All right, so I'm just going to ask you a couple questions to make sure that you know kind of where you're at, you know what's going on. So right now, do you know where you're at?
Yes. Doctor's office.
Okay, very good. So also, do you know what year it is?
2019.
Very good. All right. And do you know who the president of the United States is? Okay. All right. Very good. So I'm going to note that the patient is alert and oriented ×3. So what we're going to do now is just review some of her past history. So what I'm going to do is just ask you some questions, and then we'll begin the exam, okay? Mm-hmm. All right. So what we're going to start with is your past history. Do you have any history of abdominal pain or any surgeries or anything?
No.
Okay. Do you have any issues with like your bowel habits, any constipation, diarrhea?
No.
Okay. Can you tell me about your diet, like what you had to eat the last 24 hours?
Some pizza. Some Domino's pizza.
Okay. What did you have for breakfast?
A bowl of cereal.
Okay. Is that something that you normally have?
Yes.
All right. Do you exercise?
Yes.
Okay. All right. How often do you exercise?
Maybe twice a week.
Twice a week. Okay. All right. So I just asking the patient how her bowel habits are, and if she has any issues as far as diet. She does exercise, which is also a good thing. Sierra, how about your urinary habits? Do you go to the bathroom frequently, or do you think you do it a lot? Like going to pee?
No.
No. Okay. Do you notice any funky smell or the way it looks or anything when you pee?
No.
Okay. What about your sexual activity? Are you sexually active?
No.
Okay. So you're about 18 years old. So tell me about your period. When did you start your menstruation cycle?
When I was either 13 or 14.
13 or 14. Okay. Are you pretty regular with your?
Yes.
Okay. Any issues as far as skipping periods or having abnormal blood flow or anything like that?
No.
Okay. All right. Very good. So so far there's nothing abnormal that I can see in the patient. I do want to know, do you take any current medications?
Nope.
Any supplements?
Nope.
Okay. Okay. What about any self-care behavior? What do you do? I know you exercise. Tell me about your hygiene habits.
No.
Do you bathe, shower?
Yeah.
Okay. How often during the week?
Twice. Like every other day.
Okay. All right. Well, it seems that the patient is pretty healthy overall. So what I'm going to go ahead and do now is have the patient lie down, and we're going to start the assessment. We got your head on the pillow there. Are you comfortable?
Yeah.
Okay. All right. So what I'm going to do right now is I'm going to go ahead and pull your shirt up, okay? We're just going to pull it right up to here. Pull these down just a little bit just so I can get to your abdomen. So what we're looking at right now is I'm looking at the contour of the abdomen. It is flat. It is symmetrical. There are no moles, bumps, lesions, abrasions, anything like that that I can notice, no masses or anything so far. The umbilicus is central, so that looks really good. And the skin color and the hair distribution is even, and she is warm to the touch, so there's no issues there. What I'm going to do next is go ahead and auscultate. Okay, so that means I'm going to be listening to your vowel sounds. So what you have to do is just kind of breathe normally. You don't have to do anything. Okay?
Mm-hmm.
All right. All right, so right now I'm listening to the right lower quadrant. I would call that normal active. Now I'm going to listen to the right upper quadrant. Left upper quadrant. Left lower quadrant. Okay, so I'm hearing normal vowel sounds, no hypo or hyperactive vowel sounds. So everything sounds pretty good. Nothing out of the nothing out of the abnormal. So now what I'm going to do is I'm going to listen for your aortic, renal, and ileus arteries. All right, so to find the aortic valve, what you do is you go above the umbilicus. I don't know if they can see me. And you have your fingers spaced evenly. So you have your renal arteries, and then you have your aortic artery right here in the middle. So what I'm going to do is I'm going to put my stethoscope back on. Okay, and I'm going to place my fingers back above, right on the patient's abdomen, and I'm going to follow the lines of my fingers. So right now I'm listening to the right, or listening for the right renal artery. Aortic. And left renal artery. I don't really hear anything, and that's a normal finding. So next what I'm going to do is I'm going to place my fingers in a V, and this is going to be the ileum. So I'm going to go on the left. I'm going to listen here for the bruit. I don't hear any bruit, which is a good finding. I do still hear those normal vowel sounds, so that's good. All right, so next we're going to percuss. Now, let me know if you feel any discomfort. Do you have to go to the bathroom right now? Okay, because if I'm pressing on your belly and I hit your bladder, we could have an accident, so I don't want that. All right, so what I'm going to do is I'm going to start in the lower right quadrant. And if you shouldn't feel any discomfort because it's just going to be light palpation. But if you do, just let me know, okay? What I'm doing when I'm palpating is I'm going to start in the lower right quadrant, and I'm going to work my way around clockwise. And I'm just trying to feel for anything abnormal. Normal finding is I really wouldn't feel anything, which is good. If I were to feel something, it would be an abnormally large organ, which is an abnormal finding, and we'd have to look into that further. Are you comfortable? Mm-hmm. Okay. So right now I started with the right lower, I went to the right upper, now I'm over into the left upper where the spleen and part of the pancreas and stuff like that are, so in the stomach. I'm not feeling anything, so now I'm going to the lower left, which is pretty much just the descending colon and the beginning of the rectum. Okay. So I don't feel anything there. Next thing I'm going to do is I'm going to palpate. And this right here, you won't, or I'm sorry, percuss. You won't really feel anything. I'm just listening for sounds, okay? All right, so patient's kind of thin. I should really hear more of a tympanic percussion, except for over the liver and some of the other organs that are more fluid filled. Okay. That's a nice tympanic sound. That's a dull sound just because I'm over the liver, and that's in the right upper quadrant. Now I'm in the left upper quadrant. It's kind of between tympanic and dull because we've got the spleen and the pancreas over there in the stomach. And again, like I said, it's going to be in between. Now I'm in the left lower. again, tympanic. So that's a really good finding. All right, so we're finished with that part of the exam. I'm going to go ahead and have you swing your legs over and sit up slowly. All right, you doing good so far?
Mm-hmm.
Okay, so next what we're going to do is I'm going to assess your musculoskeletal. So what I want you to do is step down for me. I'm going to have you stand, try to get a little bit closer, right about here, okay? And then I'm going to go ahead and we're going to test your range of motion, okay? So I want you to stand with your feet together, okay? Do you have your balance?
A little bit.
Okay, so what this is the Romberg test, and what we're going to do is I'm going to have you stretch your arms out, and I want you to touch your nose with your finger. Okay? With this one. Okay, put your arms down. Very good. I want you to stay in the position you're in, and I want you to close your eyes. Okay, so you can open your eyes. I'm just doing the Romberg test, and what that's telling me is that the patient's cranial nerve number 8 is intact. She does have her balance, and she, so far everything's good. So what I'm going to do is I'm going to back you up a little bit. I'm going to come all the way over here, and I want you to walk towards me. And what I'm looking at is the way that you're walking, okay? Okay, very good. You go ahead and step back. So what I was doing is making sure that the patient's gait was normal. She didn't have any missteps or anything like that. The gait is normal. She seems very well balanced. Okay, so now the next thing we're going to do is we're going to do the heel slide test. So you're going to, just what you're doing right now, I want you to watch what I'm doing and then you can repeat it, okay? So I want you to take your heel and I want you to slide it down your leg, down your shin. Okay? Now I want you to do the same thing with the other one. Okay, very good. So again, I'm testing your balance. So what we're going to do now is range of motion. All right, so I want you to elevate your arms. I want you to do a circumference. Okay, I want you to put your arms out in front of you. I want you to, this is pronation. Very good. I want you to flip them like this, supination. Very good. All right, you can put those down. I want you to, so we're going to work with the ankles, okay? So I want you to invert your ankle and evert your ankle. Do this one. Same thing. And out. They really can't see you on the camera, which does not help. All right. Let's see. Next, I just want to kind of go ahead and do a push-pull test. So I'm going to push against you, and you don't let me push you, okay? And then I'm going to pull, and you don't let me pull you. All right. So go ahead and put your arms up like this. All right. So push. All right, and pull. Nope. So what you're supposed to do is not let me move your arms, okay? So I'm going to push. I'm going to push. All right, now try to get your balance, and I'm going to pull this time, okay? Okay, very good. All right, so that's it for the exam. You can go ahead and have a seat. Thank you very much. All right, guys, so that was my exam. I hope I hit everything. I hope you were able to see everything. And thank you to my daughter, Sierra. And I appreciate you taking time to listen.